Which of the following is the most common orthopedic complication in a child with a high-level, thoracic, myelomeningocele? A. Slipped capital femoral epiphysis, SCFE. B. Kyphoscoliosis. C. Osgood-Schlatter disease. D. Meniscal tear. Answer: B. Kyphoscoliosis. In the context of fetal surgery for spina bifida, which of the following is a significant maternal risk compared to postnatal repair? A. Gestational diabetes. B. Uterine dehiscence or thinning at the incision site. C. Increased risk of breast cancer. D. Preeclampsia. Answer: B. Uterine dehiscence or thinning at the incision site. What is the specific goal of the Malone antegrade continence enema (MACE) procedure? A. To create a urinary diversion. B. To allow for easier administration of enemas via a stoma to manage bowel incontinence. C. To fix a tethered spinal cord. D. To drain a syrinx. Answer: B. To allow for easier administration of enemas via a stoma to manage bowel incontinence. A patient with spina bifida presents with stridor and vocal cord paralysis. This is most likely a manifestation of A. A simple upper respiratory infection. B. Type 1 Chiari malformation. C. Type 2 Chiari malformation. D. Latex allergy. Answer: C. Type 2 Chiari malformation. Which of the following is true regarding the intellectual ability of most children with spina bifida, without severe hydrocephalus complications? A. Most have profound intellectual disability. B. Intellectual ability is usually within the low average to average range. C. They typically possess savant mathematical skills. D. Intelligence is always superior to peers. Answer: B. Intellectual ability is usually within the low average to average range. What is the gold standard for assessing the urodynamic status of a patient with a neurogenic bladder? A. Bedside post-void residual, PVR. B. Multi-channel video urodynamic study, VUDS. C. Simple urinalysis. D. Renal ultrasound. Answer: B. Multi-channel video urodynamic study, VUDS. The hair-on-end appearance on a skull X-ray is associated with certain anemias, but what is the characteristic lacunar skull, Luckenschädel, finding in spina bifida? A. Thickening of the temporal bones. B. Defective ossification of the membranous bones of the skull. C. Premature closure of all sutures. D. Absence of the frontal sinuses. Answer: B. Defective ossification of the membranous bones of the skull. A 12-year-old with myelomeningocele develops a sudden change in handwriting and increased spasticity in the legs. MRI shows a low-lying conus medullaris at L5. What is the most likely diagnosis? A. Normal growth. B. Tethered cord syndrome. C. Vitamin D deficiency. D. Cerebral palsy. Answer: B. Tethered cord syndrome. Which neurotransmitter pathway is most affected by the folic acid metabolic cycle during neural tube closure? A. The conversion of homocysteine to methionine. B. The breakdown of acetylcholine. C. The synthesis of GABA. D. The reuptake of serotonin. Answer: A. The conversion of homocysteine to methionine. Pathological fractures are common in spina bifida. What is the primary underlying cause? A. Excessive exercise. B. Disuse osteopenia and lack of weight bearing. C. High calcium intake. D. Primary hyperparathyroidism. Answer: B. Disuse osteopenia and lack of weight bearing. Which of the following is a common hidden symptom of spina bifida occulta that might lead to a diagnosis in late childhood? A. Persistent nocturnal enuresis, bedwetting. B. Early hair loss. C. Frequent ear infections. D. Excessive height. Answer: A. Persistent nocturnal enuresis, bedwetting. In myelomeningocele management, what is the purpose of an Ommaya reservoir in specific cases? A. To deliver insulin. B. To allow for frequent aspiration of CSF or delivery of medication into the ventricles. C. To stabilize a spinal fracture. D. To monitor blood pressure. Answer: B. To allow for frequent aspiration of CSF or delivery of medication into the ventricles. What is the term for the failure of the caudal end of the neural tube to close? A. Anencephaly. B. Spina bifida. C. Encephalocele. D. Gastroschisis. Answer: B. Spina bifida. What is the recommended timing for the surgical closure of an open myelomeningocele after birth? A. Within the first 24 to 48 hours. B. After the infant reaches 10 pounds. C. At 6 months of age. D. Only if the infant develops a fever. Answer: A. Within the first 24 to 48 hours. Which environmental factor, when combined with low folate, significantly increases the risk of NTDs? A. High altitudes. B. Maternal hyperthermia, e.g., use of saunas or hot tubs in early pregnancy. C. Exposure to cold weather. D. Maternal exercise. Answer: B. Maternal hyperthermia.